My name is Dr. Odom. Yes. Okay. All right. Ready? Okay. Okay. All right. Hey, Mr. Odom. My name's Dr. Odom. I'm going to be asking you some questions today. First of all, I want to talk about what we're going to be doing today. I'm going to be asking you a series of questions, just some basic information, as well as what you're here today and what we can get out of this visit. I want to let you know that this is completely private and confidential. All of your information is going to stay with me and any of the other physicians that we may consult later on, okay?
All right.
All right, so I'm going to start with asking you some basic questions. All right, so we got the name out of the way, but you can go ahead and tell me again.
I'm Brian.
Brian Odom. All right. And how old are you?
55.
All right. And what is your current job?
I am a truck driver for UPS.
All righty. How long have you been doing that for?
With UPS, 4 years.
4 years. And you were driving for someone else before then?
Yeah, for 2.5 years.
All right. And about how much education have you had so far?
Just high school, and then went to get my CDL.
All right. So you had to take some classes for that?
Right. Did it for a month.
Okay. I didn't realize it was so short.
Yeah.
All right. So, just let's start with some quick questions about why you're here today. Have you experienced any kind of symptoms in the past that you might want to talk about, or why you might be here today?
Just a little bit of anxiety, maybe, and a little bit of depression because my father just passed away in October.
Oh, really? How old was he?
85.
85. Do you mind asking what he passed away from?
Or dementia.
Dementia.
Actually, he didn't have the Alzheimer's, but he had dementia.
Okay. Is that something that runs in your family?
Yes.
Okay. We can talk about that a little more coming up. All right. Now, have you ever had any serious thoughts of harm or anything like that?
No, just
Good. Great. And so you're basically coming just so you can talk about your generalized anxiety and depressive symptoms?
correct.
Okay. All right. Now, growing up, when you were little, did you have any issues growing up that you can remember your parents talking about?
No, not really. I had basically a really good childhood.
Yeah.
Grew up in a subdivision and played basketball when I was young. Played baseball, soccer when I was young.
Yeah. Did you have any siblings?
I had an older sister.
Okay.
She was 8 years older than me.
All right. And so it was you, your sister, your father and mother growing up?
Yes.
All right, cool. And so moving on to when you were a teenager, I'm assuming you continued to play sports throughout then?
No, actually I didn't. I just, hung out with my friends mainly,
Yeah.
in my younger teenage years, and then later started working,
Okay.
in my mid-teens.
About when did you start working?
I actually started working when I was 15 at a place called Lancerlot that was, they played hockey, and I
Oh.
worked the concession stand.
Oh, interesting.
And then I went to Kmart when I turned 16.
Oh, okay. Classic job.
And I'd get out of school early
Oh, really?
to go to work. It was a class, distributive education is what they called it.
And it was dedicated to you having a part-time job?
Yes.
Oh.
you took your main courses and then you went to work afterwards.
That's so interesting. And did you enjoy doing that?
Oh yeah.
Yeah?
Got out of school.
Yeah. So I'm guessing school was not your primary interest growing
No.
up. No?
No.
That's all right. So, about when you graduated, did you decide you wanted to go for more education, wanted to do a vocation job? What were you thinking?
No, I actually just wanted to start working full time.
Right?
And I went to work for a company called Precision Fabrics in Benton and started out at the lower level and worked my way up to a higher level, but not management, but the highest level I could go as far as labor goes.
Okay.
I worked there 16 years.
Really? Did you enjoy that position?
I did.
Yeah.
That was probably my funnest job that I've ever had.
Really?
Yeah. Really good people.
What made it so much fun for you?
Just the people
The
and the
people.
atmosphere. Yep.
Was this a larger company or?
No, it was mainly just a real small company.
Okay. And so, now I know you're married. About when did you start dating your current wife, or?
We started dating when she was graduating high school, and I was out of school for a year. And she was a waitress at Shoney's.
Okay.
And a friend of mine that I was hanging around with was dating a girl that worked there, and I saw my wife, and that's how we met.
That was history.
Yeah, I wanted to go out with her, and that's how we met.
About how long did y'all date before you decided to get married?
2.5 years.
Okay. So that's a good while. And do you have any children?
I have 3.
3 children?
3 boys.
All right. I'm lovely, I'm sure.
At times.
Yeah. They can be a handful.
Yes.
So moving on to your current relationships and work, how would you describe your current work life?
I mean, it's pretty good, I guess. I mean, I drive over the road running team routes with my nephew.
Oh, okay.
So,
how did you get to working with your nephew?
He already worked at UPS, and they brought sleeper teams in, and he had enough seniority to get one. So me and him took one, and we've been doing that for about a year now.
Nice. And you enjoy that?
I love it.
Well, that's worked out really good. Do you have a lot of friends at this position, or do you mainly...
I have a lot of acquaintances.
Acquaintances? Yeah.
I don't really necessarily call them friends, but I have a few.
Would you say you're super social or more kind of introverted, or...
I don't know. I mean, I don't see these people. All I do is talk to them on the phone, because it's just me and my nephew.
Right. I guess it is hard to socialize when you're driving the majority of the time.
Right.
All right. And what about your family now? Are you living with your wife and kids? Are you taking care of parents? Anything like that?
It's me, my wife, and one son left. And then my mother lives in an assisted living.
Okay.
So we still go up there and try to take care of her as much as we need to and can.
Right. I know that can be a struggle as well.
Yes.
How has that transition been?
For her, it's been pretty hard. For us, it was sort of a relief.
Really?
Because we knew somebody was watching after her, giving her her medicine.
And so you feel like that maybe has helped with your anxiety, having her being watched over?
I think so.
Yeah?
Yeah. It has helped.
Would you say that her being in this assisted living has contributed to some of your depressive and anxiety symptoms, or was
It
it
was
before
mainly
that?
before that, with my father having dementia and having to move him in there and
Right,
having to deal with him, and then, before he moved into the facility, and then, you
right.
know,
Yeah, I know taking care of dementia patients, that can be a full-time job in and of itself. But would you say you had a good relationship with your father
oh yeah,
and everything? Good.
yeah.
Well, that's good. And then, so we talked about your family. You're living with your wife and son, and your mother's in assisted living. What about your other sons?
Um, they both live in apartments, separate.
Okay.
Um, they're both working and doing their thing, I guess.
Well, that's good. As long as everybody's taken care of.
Yeah, I don't talk to them as much as I need to.
Mm. Would you say that your relationship with your children has contributed to your anxiety and depression, or
Somewhat.
somewhat? All right, well, we can talk about more of that coming up. So, you mentioned at the beginning that you were here for some anxiety and depressive symptoms. Were there any other medical issues that you can think of that may have been contributing to your symptoms recently?
Uh, Not really. No, I think that's really all. I worry about having memory problems.
Right. Have you experienced any memory issues recently?
Well, I mean, I don't know if it's memory issues or just age.
Right, right. Well, we can definitely talk about that. And are you on any medications
I
or
do take medication for
Okay.
anxiety.
for anxiety? Okay. So have you seen a physician in the past for your anxiety? Was it a psychiatrist?
No, it was just a family doctor.
Family
so
doctor?
I thought it'd be better to come and
Okay. Well, we are absolutely ready to help. Do you know exactly what medication you're on?
Zoloft.
Zoloft? Okay. And would you say that that's helped so far?
It has helped.
Yeah? Good. Anxiety and depression, or just anxiety?
Just
depression?
anxiety, really. I mean, the depression is working itself out.
Okay. Have you ever gone for any in-person therapy or?
No,
No?
not till now.
All right. And what about your family? Have they had any interaction with therapy, any history of mental illnesses in other people in your family?
I don't know that I've had mental illness, but I know some of my family has gone to a psychiatrist.
Okay. Do you know if your mother or father ever went?
I do not know.
Yeah. Different time back then. All right. Now, and what are we want to talk about our treatment and what we are planning to get out of this. And so you talked about your anxiety getting better and with the Zoloft, and your depression seems to be working itself out. So what would you really like to work on in therapy?
I mean, I'd like my anxiety to be a little bit better,
Okay.
and just be able to have, someone to talk to about the depression,
Right.
to help it along even more.
Do you feel comfortable talking about that with your family and friends, or do you feel like you would rather...
Some of it,
Yeah,
but most of it, I would feel better
talking to...
talking to somebody else.
Okay. That's totally understandable. And so you're open to medications and you're open to therapy now, so that's good. And so we have a lot of options that we can work with. So after reviewing some of your basic information, what I'm thinking is We're going to start with some cognitive and impairment testings. You mentioned that you were worried about your memory, so we have a few options there we can test for memory. And then I just want to add in a couple personality tests just to get a little bit more information about what we're working with and where you stand. And then once we have those results, we can discuss further about what we're thinking and how you feel. And then we can move on to treatments such as medications, additional therapy. Although sometimes we do have to do more in-depth testing, some of these can be quite long and extensive, and so we will set aside a whole dedicated day to those. But we can definitely talk about that more as we review some basic information and get these initial tests done, okay?
Okay.
All right, so we'll get started with that, and then we can discuss the results and treatment later on.
All right. That
All right.
sounds great.
Thank you so much.
Thank you.
All right. That wasn't too bad. 15 minutes.